Penile pain is a common symptom among men who experience or suffer pelvic pain. Today we're going to talk about what common mechanisms of injury may cause penile pain, what the symptoms are, and most importantly, how to treat it. So the penis is innervated or supplied by the dorsal branch of the pudendal nerve. It is called the penile branch or the dorsal branch of the pudendal nerve, and it travels up the dorsum or underside of the shaft of the penis, ending at the tip of the penis. Therefore, it supplies the sensation to the shaft of the penis and the tip of the penis. This is often why men who experience penile pain, when the penile branch is involved, will typically report pain at the tip of the penis. Now, in general, nerves are irritated by sustained compression, sustained stretch, or overstretch. So with the penile branch specifically, it is more vulnerable to overstretch or sustained stretch, particularly during sexual activity. So today we're really going to focus on in what ways with sexual activity is this branch provoked or made vulnerable and resulting in penile pain. So first, let's talk about an overstretch injury. So during sexual activity, whether it's partnered or masturbating, the penis can be overstretched or quickly stretched in an erect state, therefore stretching the nerve in the penis. So in this way, if that nerve is overstretched, say with aggressive masturbation or a quick movement during intercourse, that nerve may become irritated and result in pain. Another way that the nerve can become irritated is with sustained erections or elongated erections that may be medication induced, say with drugs like Cialis or Viagra that cause a prolonged erection. And when a penis is in a prolonged erect state, that nerve is stretched. Other ways that the nerve is stretched during erection could be with a technique called edging or delaying ejaculation. Another way this nerve can be stretched is with a technique called jelqing. Now, jelqing is a technique that its intent is to elongate or make longer the shaft of the penis. And this is done by a sustained stretch or repetitive stretching of the shaft of the penis. Unfortunately, there isn't any data to support that this technique actually results in longer length of the penis. And unfortunately, it can be quite injurious to the penis because of its effect on the penile branch of the pudendal nerve, and it can result in penile pain. So let's talk about what the symptoms are initially when men experience penile pain, possibly due to one of the mechanisms of injury we just reviewed. So initially, men may notice an irritation or pain after they ejaculate or post-ejaculation. Now, this discomfort may last for a few minutes or could increase to lasting for a few hours to a day post-ejaculation. That may evolve into a hypersensitivity to touch of the penis, maybe only in an erect state or post-ejaculation, but it can evolve into discomfort when the penis becomes erect. Again, remember, when the penis is erect, it puts a little stretch on the penile branch. And if that nerve is not aggravated at all, that should be perfectly fine. But if that nerve is irritated, just being in an erect state can result in pain. Now, this can evolve into pain in a flaccid state if the nerve becomes that aggravated. So it may be a sharp, stabbing, lancinating pain, typically in the shaft to the tip of the penis. Men may start to notice a hypersensitivity where they're uncomfortable in tighter fit underwear or tighter fit jeans. They may notice a little discomfort with urinating, possibly pain in the penis when sitting, maybe with certain types of activity, or possibly if the nerve becomes irritated enough, it may affect the man's ability to get and maintain an erection, and they may notice a difference in the force of ejaculate. It may be decreased. And if the nerve becomes aggravated enough, they could notice a loss of sensation or a loss of sensitivity combined with penile pain. So let's talk about how penile branch irritation can lead to muscle dysfunction, which can lead to sexual dysfunction. So this nerve supplies a group of muscles called the urogenital diaphragm. And the muscles of the urogenital diaphragm are basically the ischiocavernosus, bulbospongiosus, and transverse perineum. Now these muscles play a special role in sexual functioning. So in order for them to work properly, they have to have good range of motion. And in order to have good range of motion, the muscles cannot be tight. If you think about your bicep, if my bicep is contracted, I don't have good range of motion, therefore I don't have much strength. If my muscle is nice and lengthened, I have good range of motion and I can have full strength. The same happens in our pelvic floor. So if the penile branch is irritated, it's going to tighten the muscles of the urogenital diaphragm. Therefore, if the muscles are tightened, when a man tries to get an erection, it's going to be more difficult and could result in erectile dysfunction. Now that he may still be able to get an erection, but the quality may be reduced, or the force of the ejaculate may be reduced. Therefore, men with penile pain will often, in addition to reporting penile pain, will notice changes in their sexual functioning. So there's often a lot of confusion between nerve irritation or nerve damage. The definition of neuralgia is an irritation of a nerve. So penile pain due to dorsal branch or penile branch irritation is a type of pudendal neuralgia or irritation of the nerve. So the symptoms of that are, as we've been discussing, pain in the penis, possibly pain with ejaculating, possibly decreased erectile functioning. When a nerve has been further compressed or more injured, a neuropathy could occur. Now, neuropathy is a more significant injury or possibly damaged nerve. Now, symptoms of a neuropathy, as far as the penile branch goes, would be possibly loss of sensation, numbness, not an altered sensation or a little decreased sensation, but true numbness. And by numbness, if you touched your penis, you would not be able to feel that sensation. Like if you went to the dentist and had a Novocaine injection before having a filling done. So numbness is a true loss of sensation, which is an important distinction between altered sensation, which could indicate more of a neuralgia. The other important component in a neuropathy is loss of motor control. Now, this may mean a complete inability to get an erection. It could be incontinence or the loss of urine, so you don't have control of your urine flow. That combined with a loss of sensation could mean that there's an actual neuropathy and needs to be addressed by the appropriate provider sooner rather than later. And who is that appropriate provider? That's someone who specializes in pudendal nerve entrapment and may offer a procedure to relieve an entrapment or compression of that nerve. So if you're experiencing penile pain or pudendal neuralgia with the symptoms of penile pain, after going to your urologist to rule out other possible sources of pathology, if all of those tests are negative or nothing is found, it's time to visit a pelvic floor physical therapist. So at a pelvic floor physical therapist evaluation, we first talk to you about your symptoms. how they occurred, when they occurred, what were the activities surrounding the beginning of these symptoms. And we want to understand why this is happening, not only so we can help resolve the symptoms now, but we can prevent them from coming back another time. So we really need to know the full story on how, when, and why these symptoms began to occur. After we have a full history and we really understand how you got to be in this place, then we do a full exam. And a manual exam consists of examining the tissue, muscle, nervous structures, and your structure of your pelvis, so we can understand what muscles and tissue may be influencing this penile branch. So we begin with an external exam, which essentially is looking at the tissues from your belly button roughly to your knees and examining all the tissue around the genitals. Then we follow with an internal exam, which is one finger inserted anally to examine the pelvic floor muscles and the nervous structures. And so what we're looking for is tension upon palpation or touch combined with your report of discomfort. Now, these muscles shouldn't be painful upon touch or palpation. The nature of the exam is not necessarily pleasant, but touching the muscles should not be painful. So if we recognize tension in the muscles combined with the patient's report of discomfort upon touching these muscles, that's a significant finding and tells us that those muscles are likely contributing to your symptoms. We do the same thing with palpating the nervous structures, specifically the pudendal nerve, and even more specifically, the dorsal branch of the penis. Now, touching these nerves, again, should not be painful. If they are, that is confirmatory that the nerve is indeed a contributing source to the penile pain, and that we need to consider it in our treatment plan. So once we have done a full examination and we have all of the information we need, we sit down with the patient, discuss our findings, and discuss what our treatment plan may be. Now, typically treatment is once a week for an hour, possibly a little more. The duration of treatment can really vary on how long you've had your symptoms, how severe the symptoms are, but in general, I usually tell my patients to count on about 12 weeks, maybe more, of weekly treatment. And during those weekly treatments, we perform manual therapy. We also give you exercises on our things to do at home that can facilitate your rehabilitation. We may also talk about referrals to other medical providers that we think could positively contribute to your rehabilitation plan. Those referrals may include a pain management specialist, possibly a mental health specialist, if we think something like a mindfulness practice or cognitive behavioral therapy may be beneficial to your overall rehabilitation and recovery. Throughout the process, of course, we're speaking to our patients and modifying as needed, as every patient is unique and requires slightly different adjustments to their treatment process.